My guest today is Tarun Mahajan, who comes from a medical background, spent many years as a pediatric cardiologist, and then made the switch to business, got an MBA, has worked internships in corporate development and marketing and pharmaceuticals and medical devices, and has spent the last few years in management consulting. Tarun, welcome. Thanks so much for joining us. It's a real treat to have you.
Thank you for joining me, Andrew. Thank you for having me, I should say.
I would love to start out by first just getting a sense of your background. Can you tell me, how old are you, what's your academic background, and where have you worked in the past?
Absolutely. I am 36 years old. I attended college at Rice University, where I double majored in biology and economics. Did my MD at the Baylor College of Medicine in Houston. Did my pediatrics residency down there. Moved to Boston Children's Hospital, up in Boston, obviously, at Harvard Medical School to do my pediatric cardiology and electrophysiology fellowships. Got my MBA from Stanford, and I am now with the Boston Consulting Group as a management consultant.
Cool, awesome. Talk to me a little bit about how your career path has unfolded and taken you to your current role, and in particular, if you could share maybe what were the major thought processes that went through your mind at critical moments along the way. That would be really helpful.
Sure. So I think it really goes back to college. So I double majored in biology and economics because I really liked them both. And this is the mid to late 90s in Texas. At the time, no one was really thinking about combining business and medicine too much. And so as I progressed through junior and senior year, my advisors, both formal and informal, said, okay, you have to make a decision. Are you going to go be a physician, or are you going to go do consulting or banking? Or I even thought about doing a PhD in economics at one point. And so faced with that decision, I had done volunteering experience, I had worked in hospitals. I said, okay, I really love medicine. I'm going to go do medicine. And so focused on that exclusively. Went to Baylor, had a great 4 years in medical school, knew that I wanted to do pediatrics because, well, I love kids, and a lot of my friends have described me as a bit of a goofball, so it was a good fit. Had a great 3 years as a pediatrics resident, and knew that I wasn't really wanting to do general pediatrics. I just couldn't see that for myself. Knew I wanted to specialize, and cardiology really attracted me most. I think it was for two reasons. I think it was first, there's the combination of invasive, like catheters and pacemakers and defibrillators, with non-invasive therapy and treatment. I thought that was really cool. Second, this probably sounds a little weird, a lot can go wrong developmentally with a heart during gestation. So there's a lot of different congenital heart defects out there. So treating them is actually a very challenging thing to do. It requires a lot of thinking in each individual case. And I thought that was really cool and challenging. So went up to Boston Children's, did my base cardiology fellowship, and along the way I fell in love with electrophysiology, which is the treatment of heart rhythms and rates that are abnormal, diagnosis and treatment. So that entails pacemakers, catheter, ablation, doing simple stuff like reading EKGs and Holter monitors, etc. I chose that path because, frankly, I found it really fun and challenging. It was during my first really year as a cardiology fellow. I did my first rotation, and I fell in love with reading EKGs, thinking about the way that rhythms worked, and thinking about working within the body to actually change and heal things that had gone wrong. So went through that. It was 2.5 years of base cardiology, 1.5 years of electrophysiology, having a great time, and is getting to the point where I'm applying for academic jobs in pediatric cardiology, thinking, well, that's going to do. All along the way, though, I'd always had sort of niggling doubts in the back of my mind, thinking about business. Double majored in econ, had always kept track of these things. Several of my friends had actually left medicine for business, and they were all having a great time. My brother had a PhD in double E, electrical engineering. He actually went to McKinsey after getting an MBA. So there were some people who had done similar things, and they all seemed really happy. So I thought, well, this is still something I'd like to do. I think given my medical background, if I can combine that with some really good, solid business knowledge and expertise, I can make a really unique impact. And finally, if I'm going to make this transition, now at the end of fellowship is the time, because once I get into an attending physician position, it'll be difficult to extract myself. So that drove me to go to Stanford and get an MBA. I really wanted to get an in-depth understanding of business. I wanted to get that MBA. Stanford offered a great opportunity to really couch that with, as you know, the combination at Stanford of business and engineering and medicine and all of that within the university and outside, I thought was a great opportunity. So that dictated that. And then at the end, I ended up jumping into consulting. That was an interesting decision. So I had done 2 internships. One was in the biopharma industry, one was in the medical device industry, and I had realized that my level of expertise in medicine, just because I'd spent 11 years there, far exceeded what I had in business. And I realized that if I approached a medical device or a biopharma company at the time, they would be so excited about my medical knowledge, they would treat me as a cardiologist who happens to have an MBA. That's not what I wanted at all. I wanted to be able to combine them and make a really effective impact, really driving a company having an impact on the company's direction, having an impact on bringing products to market that would improve patients' lives. And so I thought about it, and I realized that consulting was probably best. I was looking for a very intense experience, almost a residency in business that would enable me to get really into the details, not worry about being treated as a cardiologist, just someone who was slogging through PowerPoints and Excel, dealing with business problems. And the goal, this sounds glib, but this actually went through my mind, was to get as comfortable reading financial statements as I am reading EKGs. And I think I've finally gotten to at least something approaching that point. And so I've been at BCG for about 2 years and having a great time.
Awesome. That's quite a story. So I'm curious, you mentioned that, you saw your brother and, his friends who had gone into business, and that sort of started getting you thinking about wanting to get a more well-rounded, academic and professional exposure in business. When did that gestation period begin? When you started thinking about, I wonder if I should keep going down the medical path and go into a general physician role versus trying something else. Like, how long was the gestation period before your first thoughts and actually deciding, yes, I'm going to apply to business school?
I think it was probably, it had been in the back of my mind for a long time, reading the journal, keeping up with business a little bit, having some vague idea of what was going on. That actually was really a lot through medical school and residency. But it was only when I got to fellowship, interestingly, that it really began to take shape. And I think it was a lot of things. I think first, from a personal standpoint, I think that was around the time that my brother started to make the transition. He's an older brother, someone I respect very much. And I thought, okay, that's something to think about. At the same time, some of my friends who'd been in medicine, they made the transition. It was clear that they were having a good time, so that played a role as well. And finally, I think there was a little bit of exposure to the business side of medicine during cardiology fellowship. So pediatrics isn't a very profitable market for anybody for the most part. There's a couple companies who specialize in sort of very specific diseases that can make a run at pediatrics. But during pediatrics residency, I never really had much exposure to any of the companies. I actually think it's a good policy. We didn't have any drug reps, and certainly there's no devices that impact the lives of children in a general pediatrics residency you have to think of. But once I got to cardiology fellowship, and especially in electrophysiology training, we certainly had the representatives from Medtronic and Boston Scientific and St. Jude and Johnson & Johnson coming through and telling us about catheters and telling us about these devices. And I began to wonder a little bit about what was all the business behind all of those devices that I was using every day and found so incredible and cool. And I just started talking to them a little bit, learned more, and I thought, that could actually be a really cool thing. So, it was always, one of the reasons I chose the MBA was I can go get the MBA, and if I find out it's not for me, I can always come back to cardiology, I think. But this gives me a little bit of an out. But I have not regretted my decision to leave for one moment since. I had a great time.
Awesome. And then when you were in business school, or I had noticed you did a corp dev internship even before business school.
That's right.
Is that right? And then you also did a marketing internship while in business school. Was it challenging to persuade folks on the business side that somebody who had such a deep science and medicine type of training could adjust at the speed needed into the business world? And how did those conversations go? How did you persuade people?
That's something that was actually very difficult, and it's part of my decision, part of what really drove me to go into consulting. So yes, I had an internship in corporate development at a biotech company before starting business school. I thought that would be a good idea because I wanted to get a little just basic grounding in the way that business worked and understand some of the terminology before coming into business school. And so it certainly gave me that. I think the challenge was twofold. The first was getting people to respect me. And actually, that was not a huge problem at that particular company because the director and the vice president to whom I was reporting both came out of medicine or science. The director had a PhD and had actually run his own lab at Harvard. And the vice president was trained as an internist and had some great training on his own before going to Wharton and then coming to the biopharma industry. So that was a rare opportunity, and it was a really good learning experience for me. So that, as much in the first position, was not a problem. The problem really was, you know,
that one was
after
at
11 years.
Pharmaceutical, right? That one was at Millennium Pharmaceutical.
That's exactly right. That was at Millennium, great company.
Great.
And the problem was that you come in with 11 years of medical experience, you think you know everything. And then you realize you actually know nothing. And I really didn't know anything going into that internship from a business perspective. And it was a very important learning experience. So I think there's two sides to establishing that relationship when you're making a transition. It's first achieving that buy-in, which in certain circumstances can be easier than in others, but it's also making sure that you have the knowledge and expertise that gives you credibility to do so. So with that first internship, it was the right environment and everyone was great to me, but I don't think I had much to offer them. I learned over the summer, I really did, but it wasn't, as I started, there wasn't much to really convince them to give me a lot of responsibility. That was a challenge. It was just building with the responsibility on my own and then convincing them. The second internship was also a great experience. That was at Boston Scientific in their pacemaker and defibrillator division. Great people, great experience. But there it's a little bit thinking about, again, I'm a cardiologist. This is a cardiac company. And so how do I persuade people that I am, in fact, also a businessman? They treated me very well, but I wanted to make sure that I would be treated as someone who was truly equal in both. And so that's, again, what really drove the decision to consulting.
Got it. And, I mean, the Boston Consulting Group has a tradition of hiring people with, enhanced backgrounds, I'll say. Right, and yeah. I imagine like doctors are not super common, and so was it an easier process getting into consulting coming from Stanford, or was it just as challenging? And how did you persuade them that you would be able to handle the work?
I think that yes. So I think especially the big three firms, they've been making a bigger push to hire more MDs and PhDs. When you talk about the big three, I think McKinsey's been doing that for a long time. They've done a great job. I think BCG and Bain, to some extent, they have only recently focused on that more recently. I know they're both hiring a lot of MDs and PhDs at this point. It's something they view as valuable, especially in something technological, especially in healthcare. And so in my case, it really wasn't convincing that I could do the work mentally. I think, I had a strong resume. I'd spent 2 years at Stanford. I had some good work experience. So I think they were comfortable with that. I think their main concern was, you've done all this medical training. You're a little older than our typical first-time applicant. Are you going to be able to handle the workload? And they could see from my experience that I could probably handle it, but are you willing to handle the workload is also another question. There might be a little bit of entitlement, perhaps. You've already put in your time. You've put in those long residency and fellowship hours. Do you really want to do this again? And that was actually challenging for me to convince them that, in fact, I could.
So what did you say?
I told them, I was honest with them. I said, I like working hard at things that are fun and interesting and challenging. I'm happy to work hard. I think my past experience has definitely shown that. I think that I am more than happy to do it again. And I think it was key in sort of couching it, I'm willing to work hard if it's interesting and challenging, and if I learn and get something out of it as well. Sort of couching it, what I get out of it too, it makes it a little more real for them, I think. It makes them understand, okay, this is something he's thought through, as opposed to someone just saying, yeah, sure, I'll work hard, that sounds good. I made it clear that I wanted to get something out of this as well, and sort of establishing that, in fact, there was a two-way sort of communication and two-way exchange, I think did a lot to convince them.
Sure. Okay. Talk to me a little bit about the day-to-day in each of the roles that you've had, because they've been so different in your residency, in your fellowship, and now in consulting. If I were to shadow you for a week or a month in each of those roles, what would I observe?
That's a very good question. Residency and fellowship, both of them are built on month-to-month sort of rotations, if you will. But I'll talk about sort of the more specific sort of inpatient. Those are sort of the classic experiences you get. So classic inpatient non-ICU rotation. So as a resident, let's say as an intern, as a low man on the totem pole, you come in at 7 a.m., maybe 6:30 a.m. It depends on your specialty. It depends on the hospital. But at Texas Children's for pediatrics, we typically came in around 6:30 or 7. And you see the patients that are assigned to you. You examine them. You generally check in with the intern who has been on call overnight. And you find out what's happened with those patients. You go examine them. You talk to them. Hopefully you're able to talk to their nurse, figure out what's going on, because I can't say enough about how valuable nurses are, especially to interns and residents, especially as interns, because you really don't know what you're doing. So you talk to them, and then you examine the patient. Because it's pediatrics, you inevitably talk to the parents as well, which is a great communications lesson, to be honest. And then you present the patients on rounds. You talk about, Bobby is a 5-year-old with such and such diagnosis. He's been here for 3 days. He's improving or declining in X, Y, and Z areas. His physical exam overnight is unchanged. Any relevant studies overnight showed X, Y, Z. This is our assessment for today, and this is the plan I've arrived at. And so, it can be additional testing. It can be calling in consults from other services. It can be perhaps hopefully discharge. It can be some combination thereof. And so that's sort of a classic day on a pediatric rotation. After you've presented on rounds, you actually carry out what you're expected to do. You call your consults, you order your tests, you talk to perhaps a primary physician, you go back and have a conversation with the parents. You are called, obviously, if there are problems with any of your patients. When you're on call overnight, the way it was at Texas Children's, at least when I was there, is it was a 36-patient floor. You're responsible for all 36 patients. So any patients that are admitted, you have to do a full history and physical, and all 36 patients that are already there, you're responsible for what we call cross-cover, which is taking care of them and being there for any problems that may arise. So that's kind of the classic intern residency experience. Cardiology fellow, as a first and second year, you spend a lot of time doing invasive procedures, catheterizations, etc., cardiac catheterizations, where you're putting catheters into the heart, you're doing interventions and doing analysis on data. But you also spend a lot of time doing ICU, and you spend a lot of time doing inpatient, sort of supervising on the cardiology inpatient service. I think it might be interesting to talk about the cardiac ICU. So at Boston, there was a 25-bed cardiac ICU. These patients are very, very ill, and they're either post-operative from congenital heart surgery, or they are very ill and awaiting some sort of medical and or surgical treatment. And so most of them, the vast majority, are intubated, meaning they have the tube down and they're on a ventilator. A fair number of them, especially if they're post-operative, they have actually open chests. So essentially the chest is still cracked open, covered with the sterile surgical dressing, because you have to wait for the swelling to come down to actually close the chest. And a lot of patients on very intensive life support, ventricular assist devices, dialysis, all sorts of things. So it's a really intense experience. And as first-year fellows, literally you were on call by yourself. You could always call your attending, but you were on call by yourself from typically 7 p.m. until 7 a.m. It was an amazing learning experience, but very, very challenging. You're responsible for every patient in that ward, and anything that goes wrong, you got to figure out. You can always call someone, but it was really your call on what you were going to do. So it was very intense. So you take call by yourself. In the morning, again, the other fellows come in. They help you with whatever tasks you may have, and then you run rounds. At Boston, it was literally the post-call person's responsibility to literally run all 25 patients in that unit. So tell everyone what happened overnight, what interventions were performed, how their labs were looking, and arrive at some sort of preliminary plan that is then approved on rounds by the attending and the senior fellow. So, yeah, it was an amazing learning experience in terms of prioritizing, because 3 kids can be doing very poorly at once, in terms of thinking about plans on your own, and in terms of communication, because you have to as quickly and concisely as possible present 25 patients on rounds. A great experience.
You mentioned a moment ago that, I want to follow up on 2 things. You mentioned a moment ago that talking with parents, being in a pediatric rotation, is a great lesson in just communication. I was wondering if you could explain a little bit more about what that means and what you learned. Maybe if there's a specific example or a story that you can think of. Yeah,
sure. So anytime a child is hospitalized, the parents are by nature going to be emotional. And so, you're communicating very often, at least not necessarily terrible news, but bad news. I mean, even if you tell a child that has, say, a moderate case of pneumonia, or has gotten dehydrated because of the bad case of gastroenteritis, the child is going to be hospitalized for a day or 2. That in itself is bad news for a parent. You know, most children go through childhood without needing hospitalization. It's out of the ordinary. It's difficult for them to deal with. So a lot of times, actually, it's that parents of the healthiest children who break down, you know, because they just aren't prepared for it. Dealing with parents who actually have chronically, critically ill children is another challenge in itself. Yes, these parents are well aware of sort of the routines and the mechanisms of a hospital and of an ICU, but they're understandably frustrated. So, yeah, I can absolutely give you an example. There was a child who was critically ill, who had a very complex congenital heart defect, and who had been operated on at several of the other leading centers in the U.S., and it wasn't going anywhere. And so they brought the child to Boston, sort of as a last resort. And the child was operated on, came out of the OR at around 6 p.m. I was the on-call fellow, and around 1 a.m., the child began to crash. And so we literally had to, I don't want to get into the nature of the defect because we could talk about that for hours, but essentially it involved me manually having to push in with all my force, and I'm a reasonably big guy, manually pushing with all my force albumin and blood as fast as I could get in, because I had to maintain this child's blood pressure while this child's blood pressure was crashing. And the parents who had been through a lot were just extraordinarily frustrated. They didn't know what was going on. There had not been, and this may have been partly my fault because I was busy all night, adequate communication with them. They were frustrated. And I'll never forget, this father is a huge guy. Like, I'm talking, this isn't exaggeration. He could literally be a professional wrestler. As I'm doing this, is literally in my face. And at one point, I've probably pushed 3 syringes already, which are pretty large. And I put my hand on him and say, "Sir, I need to do this right now, or things aren't going to go well." You know, putting it in the immediate sense, that made him back off a little bit. And then as soon as the blood pressure was stabilized, I went and talked to him. And thankfully, the ICU was slow. And I was able to spend about 15 or 20 minutes describing exactly what we thought of his defect, what the plan was, why his blood pressure just crashed, why I had done what I had done, what I would be looking for the next 4 to 5 hours, and what we would do if things went in various directions. And then, perhaps more importantly than anything, all I said was, "Do you have any questions or concerns?" And both parents cried for a good 15 minutes and just talked. And it was clear that no one had really listened to their frustrations in a while. It's an important lesson in medicine. It's an important lesson in communication in general. And so, yeah, it was very rewarding, especially because the next morning when the other ICU fellows finally arrived, I was able to go downstairs and get some breakfast in the cafeteria. As I came out, I saw the mother and father. And again, this father is a frightening dude. He literally walked up to me, and I started to back away. But he walked up to me, put his hand on my shoulder, and said, "I just wanted to thank you, because no one has ever talked to us the way you did last night, and it means a great deal to me and my wife." And it was a very, very touching, but also a very instructive episode. Just listening and communicating, even if it takes some extra time, if it takes some extra time out of your day, is extraordinarily important, no matter the setting.
Sure. So it sounds like, you know, being transparent about all the information that you know, explaining the why behind things, and then just turning it back to them and giving them an opportunity to share their thoughts or to ask questions. Those are the key lessons.
That's exactly right. I think you got it right. And, you know, I don't think you can stress enough the importance of just listening and saying, is there anything you want to talk about? If you have that time, it can be immensely rewarding for them and for you.
Sure. Tarun, what is there a story or an example that you can tell me about that most affected you in your thinking as a physician, that, yeah, most shaped your worldview as a physician and maybe influences even the way you work in business today?
Yeah, actually. So at Stanford, we have, in the business school, we have something called the Talk Series, wherein you're invited to talk to your classmates about an experience or something that really matters most to you. And so I spent a lot of time talking about my experiences as a pediatric cardiologist, but I talked a long time about one patient in particular. Yeah, I still remember very clearly. So this is a patient who had, who had a very complex congenital heart defect and who had gotten, cardiac surgery by the world leaders as an infant at Boston, and had a rough early childhood, but then really stabilized for the most of her childhood and early adolescence. But the way that her physiology works, by the time she hit her late teens, things started to go downhill. And they went downhill in a way that bizarrely coincided with my cardiology training. And let me explain that. When I was a first-year fellow, I spent a lot of time, as I said, sort of manning the inpatient cardiology unit, taking charge of that unit, making sure those patients are okay. That was when this particular patient, I'll call her Kim, that was when Kim started to go downhill and started getting hospitalized on the unit. As a second and third-year fellow, you spent a lot of time in the ICU and in the catheterization labs, while Kim continued to worsen. And so Kim was, she was in the ICU a lot. She was undergoing cardiac catheterizations a lot. So I saw her a lot. I got to know her family well. Finally, the last year and a half of my cardiology fellowship was in electrophysiology, heart rhythms. And one of the last things that happens when your heart starts to fail is you start to get dangerous arrhythmias. Just your heart, the architecture starts to get distorted because the blood isn't flowing properly. You can think of it that way. And so she spent a lot of time on that service. And again, I was the fellow, so I got to know them very well. And then literally right before I left fellowship, she actually did pass away. And I was actually on call for electrophysiology. When a patient with a pacemaker or defibrillator dies, you don't necessarily have to turn off or on their device. I mean, the patient is gone. The electricity might be flowing, but it's not doing anything. You can't really do much. If a patient is dead, a pacemaker doesn't do anything. It just fires, but it doesn't activate any muscle. But still, it's comforting for the family to know that there's not a device in there that's still ticking. So the last thing that they did that was really done for her at Boston was I went in at 6 a.m. and turned off her pacemaker. It was a... Sorry. It was actually a very difficult experience because I had gotten to know her really well. And I had seen how technology, how surgery, how catheters, how pacemakers had failed her. So that's, yeah, that's really what inspired me most and continues to inspire me to this day.
That's pretty amazing. That's pretty amazing. And how do you think that's affected your outlook on the kind of physician or the kind of business person you want to be going forward? So
it was relatively late in my cardiology training, so I don't think it impacted the remainder of my medical training. I'd already decided to leave cardiology at that point, but I'm still trying to be the best cardiologist I could be. So it was just, it didn't really change that much there. It was always just to do whatever I could for the patients. But it very much instilled in me a sort of an underlying theme or goal for my career, which is, I'm going to tie in something else here about Stanford. I love Stanford, as you can tell. when you apply to Stanford, I think anyone that's ever applied to business school, especially if they've applied to Stanford, is familiar with SAA on the application. It's a very seemingly simple question. What matters most to you and why? And that's it. You just answer whatever you can or whatever matters most to you. And people take that question very seriously, both in admissions and in the school itself, and then among students and applicants. And when you get to Stanford, you talk about it, informally with your friends. And throughout those 2 years, you talk about, or rather I should say instructors and professors and deans occasionally will remind you not to forget about what you've written in that essay, to go back and review it and make sure that you adhere to what you've in fact written, because it's something that matters to you a great deal once upon a time. Not get distracted by the lure of money or other material goods. Obviously those things, you need money, you need material goods, but I think you understand what I'm saying. Not to get too distracted from your goal. And so in my essay, I had written specifically what mattered most to me was the health of patients with congenital heart disease, which was very much informed by my experience with Kim. I wrote that before she actually passed away, but she was very much on my mind as I wrote that essay. And so even now, as a consultant, I literally open up my Stanford application every few months and go back and reread that essay. And so it's an underlying theme that guides me as I plot out my long-term career trajectory. Maybe not right now, and maybe that's an overly specific goal. Maybe I won't do something specifically related to congenital heart disease. Hopefully it'll be something related to children. It'll definitely be something related to bringing products to market that improve patients' lives. That's what matters most. It mattered then, and it matters now. And so that's what guides me as I think about my career moving forward.
Awesome, awesome. I want to revisit that in a moment. I want to do the last hop, which is tell me about your current role at the Boston Consulting Group and what you do there on a day-to-day basis, maybe how it's also been informed by your experience as a physician.
Sure. So both because it's in my experience, and I think, again, this goes back to sort of an exchange. I think BCG is able to use me most effectively in healthcare because, again, I have a lot of experience there, both in my experience as a physician and then, my 2 internships prior to this. And at the same time, healthcare is what matters most to me. So my experience at BCG has been exclusively in healthcare across the biopharma and medical device spectrum. A little bit of payer provider work, but that's not quite as exciting to me. So a lot more in medical device and biopharma. And so it's been very interesting, and I've learned a great deal. As far as an average day, that's very difficult to sort of state. It varies substantially from project to project and even within projects. I can tell you a little bit at a high level about the current project I'm on. Obviously, I can't tell you much given client confidentiality, but it's been an interesting project. So it's been with a multinational healthcare client that has operations across the world. And this particular project has been largely focused on some of their stuff that runs out of Asia. So in the first phase of the project, I actually spent a lot of time in Asia working directly with sort of the key clients and also working with the local BCG team. Really intense hours, a lot of time on the ground at the client, but I think we got to a good understanding of what the patient, going back and forth, what the client's chief concerns were, got to know them personally and learn how to interact with them. It began to think a little bit about how to solve those problems. And so for the second phase of the project, I'm here in the U.S. working with some of those U.S. operations, but still maintaining very close contact with both my colleagues in other geographies as well as the client itself, which is literally spread all over the world. So it's a lot of days waking up very early for 6 a.m. or 7 a.m. conference calls, generally internally, but we sometimes have client conference calls that early as well. And really getting alignment on sort of what our overall goal for the day or coming days is. After that, I'm actually very independent. It's a really challenging but also a really fun experience. It's up to me to structure it's up to me to think about, okay, this is my big overarching problem that I'm trying to deal with this week, always keeping longer-term problems in the back of my mind. How am I going to structure my work today to get at that problem? And how am I going to structure my problem in the coming week and weeks? Because I have to be setting that up in the background as well. And so, it's very important, I think, for me to sit down for a half hour every morning and think about what do I need to do today what do I need to do today that's going to enable me to perform successfully in the next week and 2 weeks? What meetings do I have to set up? What sort of reports am I looking at? And then finally, always in the back of my mind is, what is the ultimate answer for this client? What's my current view on that? And how am I going to get there? That all feeds into each other, obviously. The day itself will inevitably involve calls to other BCG teammates in different geographies. It'll involve calls to clients, the client at their different offices. It could involve traveling to a client site here in the U.S. to talk to people in person, review processes, etc. It varies substantially. And it's consulting, so a lot of time is going to be spent on PowerPoint. There's a lot, there's a lot of that, and a lot of time spent writing emails as well. And that's certainly the less glamorous aspect of consulting. Everyone jokes about PowerPoint, but I think the really important things about consulting are A, thinking about approaching problems structurally and thinking through how to solve them. B, thinking about quantitative analysis a bit and learning that. I had no experience building a financial model before this experience, so that's been great. But C, also, I think just as importantly, thinking about communications, communicating verbally and communicating on paper. And I think consulting is a very, very good teacher of those skills. They try and sell you on this, and it seems like a little bit of too much of a sell, in that they say, oh yeah, you're going to be in conversations with VPs and CEOs. That actually is the truth. I've literally led meetings with CEOs and SVPs, companies that I never thought I would get to interact with, and it's a very much trial by fire experience, but that's a great experience that I can carry forward. So I think that's a very important part of things too.
Great. So a mix of qualitative interviews, meetings, I think just kind of core soft leadership skills in that regard, quantitative analysis when it comes to, building financial models or operating models, things of that nature, process analysis,
yeah.
And then actual presentation and communication, which I think invokes all of the suite of, communication skills that you just mentioned.
That's exactly right, yes.
Got it. Tarun, where do you see yourself ideally going in the future, medium term, long term?
Yep.
And how do you think what you've done in the past and what you're doing today will help you toward that goal?
Sure. I think that my medium and long term goals all tie back to that underlying theme that I just discussed about bringing products to market that help patients' lives. There's no doubt in my mind that my future will involve that, and so I'm very much enjoying consulting. It's a great experience, great people. But as I think about, again, medium to longer term, it's going to be something closer to patients and closer to science. I'm not sure whether it's going to be in the biopharma or medical device industries. I think I could go in either direction at this point. I think my background might lend itself more to the medical device industry, given that I was a cardiologist, but I'd like to keep at this point both options open. And I think it could be a variety of roles there. I think it would be something, hopefully, that really allowed me to, in the medium term, really mesh the science and the business. Perhaps something in business development, perhaps something in the management of R&D. It could theoretically be product management as long as it was more of a scientific product, more of a science-intense product. That could certainly be a role as well. In the medium term, I'm thinking probably a larger company, but it could be a medium-sized startup as well, something in the range of 100 employees or something along those lines. The positive lessons you learn are just as important as the negative lessons you learn. And at Stanford, I had several experiences both in the classroom and outside the classroom with the sort of classic Stanford startup. 5 guys sitting around a table in a conference room trying to build a company. And I discovered that at least at that stage in my life, it just wasn't for me. I personally like things a little more structured. That might change in the future, but I do know that early stage startup just isn't me. And that was a very important lesson to learn. In the longer run, I'm leaving all options open. Again, thinking about biopharma and medical devices. I think there's a lot of interesting options out there, and looking forward to learning a lot about all of them.
Sure. So it sounds like definitely more in industry. Would you consider perhaps going back into medical practice at all, or do you think you're probably going to stay in industry?
So I don't think I would ever go back full-time to medical practice. I'm actually enjoying business too much. I really do enjoy it, and especially at that intersection of healthcare and business, that is tremendously enjoyable. Now, I am keeping my license and my board certifications active, just in case, pardon me, my mind changes at some point down the road, and B, if at some point I want to combine the two. So say 4 days a week on the business side with maybe half a day of clinic or something along those lines. To be honest and totally frank, I don't think I could ever go back to doing invasive procedures. Again, unless I went full time, I just don't think that's fair to the patients for me to be jaunting in for 6 hours a week and doing a couple of ablations. You know, there's no way I can be as good or as accurate as someone who does it all the time. So that's something I've said goodbye to and I'm quite comfortable with. But perhaps a combination down the road might be fair.
Sure, sure. Last question for you, Tarun. What advice would you have for other people, you know, who may be a few years younger and looking at what their career options are, who might be interested in medicine, who might be interested in industry, or who might be interested in consulting, or who might be trying to figure out how to combine interest in science and healthcare with interest in business, as you have done, for them to just think about as they navigate their own career paths?
Sure. I think the first and most important thing to realize is that, in fact, you can successfully combine the two. That was something I knew. I wish I knew back when I was in college, because it wasn't clear to me at all. So I think that's a very important step to realize that, in fact, yeah, if those are the two things that interest you and they're actually things you want to pursue, then absolutely think about combining them. I think it's a very reasonable thing to do. I think, and the second thing I would say is, whenever you arrive at that decision that you want to combine business and medicine, I would tell you to pursue it and not be afraid. A lot of people sort of pushed back on me when I said I was leaving medicine after all those years of training. But it sounds silly, but I'm the only one who knows what's going on in my head and my heart. No one else can, and it was something I really wanted to do, and I'm glad I did it. And, you know, on the other end, I had medical school classmates who were 38 years old and 40 years old when they started medical school. Just don't be afraid. People have done it before. People are there for you to talk to, reach out to. That, yeah, it's something that can be done. I think the final thing I would say is, if you are in medicine, say if you're starting medical school and you're thinking about combining in some way medicine and business, it's important to discover the sweet spot for when you should leave or when you should start trying to combine. You know, if I met a college student today, there is no way I would ever tell them to pursue the plan that I did. That's a lot of time in medicine before deciding to switch. I have no regrets whatsoever. It was a process that occurred naturally and because of what I wanted to do. But think a little bit about when you might want to combine the MD with consulting or the MBA. In my own opinion, I think the sweet spot is after at least a few years of medical training outside of medical school. The MD is nice, but if you want to have credibility with a biopharma company, with a medical device company, and just as importantly with physicians who sort of align with those industries, it's important, if at all possible, to go out and do a couple of years of training. And certainly the best thing to do is do some sort of training that enables you to get a board certification, or at least be board eligible, because that says to a physician and to someone who knows physicians, okay, this is sort of a real physician who has actually practiced and who can relate to what goes on in hospitals, because it's a very different experience from what actually goes on in medical school.
Got it. Well, listen, Tarun, this was incredibly inspiring and insightful for me. I think you've had such a colorful career path so far with very real and moving stories that you've shared today, and just a really interesting transition path that you've had, and I hope it will be insightful and useful to readers and listeners as well. Really want to thank you for taking the time to chat with me, and thanks so much.
Thank you, Andrew. It's actually been a lot of fun. I really enjoyed it.
Have a great one.
You too. Thanks so much.